It was put into special measures last summer for fundamental breaches of care. Since then, Tameside Hospital says it's made big strides in turning things around. But today, a new report by the Health Watchdog, the Care Quality Commission, found there are still serious failures in patient care.
The hospital has failed to meet 8 out of 11 national standards. One of the most disturbing problems, which inspectors found, was that staff don't properly understand how to look after mentally ill patients. Well, Abby Jones has been looking at the report and she's here with more details. Abby.
Thanks, Roger. Well, the CQC made its unannounced inspection in January. It found staff don't know how to care properly for the mentally ill and those with dementia. One patient was detained unlawfully for several days. Another was given a do not resuscitate order without relatives being told. In other parts of the hospital, some staff failed to protect people's dignity. Some patients were left uncovered and exposed. And there are still staffing problems. In one building, just one nurse and one healthcare assistant for 15 patients. I've been talking to staff and patients about their experiences. Haroon Guriyahu was discharged this week from Tameside. His wife says despite his MS, he was put in an isolated, dilapidated ward and had to rely on another patient for help. His catheter wasn't changed properly and he got an infection.
I said it was like a prison cell. There's no TV. I said he can't read anything. I said it's just nothing there for him.
Tameside has been in the headlines for poor patient care for many years. Last July, it was placed in special measures. Today's CQC report also found problems keeping patients safe from abuse, and some elective operations were cancelled due to bed shortages. This hospital employee told me she has serious concerns. We've protected her identity.
Patients are still sat around for 4-5 hours waiting to be seen. There's never enough staff. They say they've brought new staff in. We haven't seen this yet. Some patients don't get treated the way they should. If they ask a question, they're told they're just in a queue, but that queue goes on for hours and hours and hours.
How are you today?
Very well, thanks.
But today's report did find progress is being made, that staff are friendly and caring. The hospital says it's now recruited 30 out of 60 permanent nurses and introduced dining companions to make sure patients eat their meals.
There has been huge change at Tameside since I've been here. It's like chalk and cheese from the very top all the way through the organisation. This is about getting nurses on the ground, filling the post, recruitment, getting people with the right skills in the right place.
Most patients we spoke to today had only praise for their care.
I was treated very, very quickly, efficiently, properly, with a really first-class doctor.
You never have a problem with your appointments, you can always park. The treatment's fine, but the waiting is a long time. I'm just waiting now for one blood test.
But making the changes the hospital needs costs money. Tameside is over £4 million in debt, but its chief executive insists they will happen. Well, the interim chief exec, Karen James, used to be a nurse, and on Monday she's changing into her nurse's uniform and going back onto the wards to see how those serious problems flagged up today can be tackled.
Abby, thanks very much indeed.
Well, earlier I spoke to Karen James and I put to her that things hadn't really improved since the last inspection.
The actual people who undertook the review have said that both patients, carers and staff were able to state that the improvements have had a positive impact of the care that's delivered at Tameside. They also found the staff to be caring, friendly and courteous. And that's really important. So from my perspective, at a point in time, we're only 5 months through to our improvement programme, and what we're doing is really having an impact. And I know that myself because I'm a nurse. I'm out talking to staff, patients and carers when I go and visit the wards, and I'm working on the wards. So I know what we're doing is changing things for patients.
But nevertheless,
but there are things.
Positive improvements are good,
yes.
But explain how a hospital still fails 8 out of 11 national standards of care.
There were some minor and moderate concerns, and that's what we expected.
But I wouldn't call not treating.
There are still improvements we need to make.
I'm sorry to interrupt, but I wouldn't include patients not being treated with dignity as minor.
I think there was one or two areas where they found that some of the nurses could have been or provided further personalised care and more individualised care to patients. And where that had been highlighted, we're dealing with those nurses directly.
You've got a lot of changes to put through. You have got improvements that you need to make before the next inspection in May, but you haven't got any money. How are you going to put these changes through?
We've put many changes in place already, so we're just going to continue the programme. This is not about funding. This is about what we do to support our staff to deliver great care, which is what the local population deserves here. So I have to say that as a point in time, we've moved on since that report. We've employed additional nurses. 60 additional nurses have been employed at this organisation, as well as additional doctors. So those things have already happened. So I expect further improvements to be acknowledged when the reviewers come back.
Karen James, we'll have to leave it there. Thank you very much.
Lots of you have been in touch with your experiences about Tameside Hospital today. Irene French from Stalybridge put this on our Facebook page. She said, 18 months ago, I believe, Tameside nearly killed me. They sent me home when I was very ill, but more recently I was treated as an outpatient and the staff were very nice and polite.
Matt Warren, also on Facebook, said, I was in Tameside in January and the staff were fantastic. The ward was warm and clean. All the staff were extremely friendly.
Tommy Stephenson emailed us. He says, it seems like what is lacking is communication between the patients and the staff.
Susan Dawson, she also emailed and she says, I've always found the nursing staff and doctors extremely professional and caring. Thank you very much, everybody, for your comments. I'm sorry we can't read them all out, but thank you for them anyway.